The first thing we thought when we heard about the COVID infection in Wuhan province in China was that this was going to come our way and it was going to cause a lot of infection. And that proved to be the case.
I remember learning about COVID at a meeting with the Public Health Agency in January 2020. And there was any other business comment about a virus that caused a flu-like illness emerging in Wuhan, which I'd never heard of, in China. And I suppose naively we all thought back then that this wasn't going to cause any difficulties for us living in Northern Ireland because Wuhan was so very far away. How naive we all were. I do remember that my response to the conversation was, I do hope we have enough PPE. And had that been considered?
We first became aware of anything to do with the potential pandemic early to mid-January when there was some early talk about it, but we had no idea just how bad things were going to become and what was going to face us. I think it became very apparent the week of the 9th of March last year, just how big a challenge this was going to become, and the risk to us and to our population was immense. And it was at this point that we needed to change things very, very quickly.
When I first heard about a new pneumonia spreading rapidly in China and infecting healthcare workers, I did think this could have the chance to spread around the world and ultimately lead to a pandemic. Looking back, I don't think we realised it would spread quite as quickly and as extensively as it did, but it wasn't a surprise to me that this was going to be something of global concern.
The first time I heard about coronavirus was probably on the news. It was something that I thought was quite far away. I wasn't particularly worried about it, and I never expected it to come to Northern Ireland. And then we were finishing our general surgery attachment at the time, and one of the surgeons had said that they were getting prepared in that hospital to deal with the pandemic, that they did expect it to come to Northern Ireland, and that it probably would result in morbidity and mortality in a large scale here. I think it kind of shocked us because up to that stage we thought, it wasn't really something to concern ourselves with. And that day we were leaving the hospital, there was a COVID patient on the ward. It said COVID on the patient's door and people were coming in and out of the room with PPE. And we were just shocked that this thing that had been on the news was here in Northern Ireland.
The low point of the pandemic in Northern Ireland was the failure of the Department of Health, in fact the 4 departments of health, to give a timely second Pfizer dose to the healthcare workers. We felt that that was a betrayal. We felt it didn't value healthcare workers, it didn't protect them. And that certainly was the low point for healthcare workers in Northern Ireland, particularly doctors.
There have been a number of low points during this pandemic. My fear for my family, my husband, our 2 children, and how we would adapt to what was the new way of living. The uncertainty of how long that would last for. The worry of how we would manage our day-to-day work as GPs, for the GP community, the fear for how our patients would be looked after.
I think definitely the low point of the whole pandemic was earlier this year, just at the change of the year, when we were in the 3rd wave. I think this is when people were at their tiredest and at their lowest, and to get the huge increase in infection numbers and everything that came with that really challenged the health service as a whole and every single member of staff. I think we're still feeling the fatigue and the after effects of that, and still will for quite some time to come.
The low point of the pandemic for me had to be the lockdowns and the inability to see friends and family. We were all working really hard and working extra long hours, and without that social support network, actually getting through each day and moving through it was really, really challenging.
I think there's been so many low points during the pandemic for everybody. I think everybody's been touched by it. From people that have lost loved ones during the pandemic due to COVID or other causes of death. I myself have lost a couple of family members since the start of the pandemic, and the whole grieving process is totally different. It's really difficult, at the time, not being able to hug people, not being able to receive people into your home, and then for a long time after, when you're not able to talk about it, because you are home alone, that was particularly difficult. So I'm looking forward to after the pandemic, being able to meet up with people and discuss, what has happened since this time last year.
Positive points. Doctors worked hard together. They innovated. Medical students stepped up. Junior doctors redeployed without complaint. Consultants and SAS doctors set up the COVID wards and worked huge hours in intensive care units, GPs, in their COVID centres, their practices and the vaccinations. A lot of work, a lot of innovation, a lot of flexibility. Profession did well.
For me, the positive points from COVID have been what we have collectively achieved. We are a year down the line from living with COVID. We have managed to continue with care, albeit in a different way. We collectively, through my work in the COVID centre, have assessed 10,000 patients whilst also keeping our general practice surgeries open.
I don't think we have ever seen the service working as quickly and as well together as we have through the pandemic. Decisions have been made very, very quickly, and the response from the health service as a whole, and speaking on behalf of every GP in Northern Ireland, the response of general practice has been truly immense.
The team working was exceptional. Everybody was in the same situation and we all knuckled down and knew that we had the job to do. And in that, there is a sort of camaraderie where you're all in this together and pulling through. It was very nice as well to see the public appreciation for healthcare workers, because a lot of healthcare workers have not felt particularly valued over the last few years.
I took up work as a medical student technician in the hospital. I think that's one of the best decisions I've ever made. Getting into the hospital and being able to see the day-to-day workings of the ward, get a taste of what will hopefully come in F1, especially during the times where patients weren't able to receive visitors, being able to have conversations with them, being able to make them laugh. You did feel like you'd come out of the job at the end of the day and done a good job.
Changes in life personally, longer hours, early morning to late at night. Professionally, working in COVID centres, working in practice, performing the vaccination clinics. A lot of extra work for the last year. It's been tiring.
Personally, I find it challenging working from home, homeschooling, and the impact that has had on all of our household relationships. As a family, my husband and I have been exceptionally grateful to all our friends and family who have supported us from a distance. Food parcels on the door, virtual hugs, phone calls, texts, reach outs by email.
In terms of personal change coming from the pandemic, I think we now value things more than we ever have before. We value the personal contact, both in work and at home, and we value just simply doing normal things, being able to get out and about, go for a cup of coffee, play around a golf, go for an evening meal, and all of those things. I think that is the one thing that we miss the most. I think the camaraderie and the meeting people is the most difficult thing of the whole pandemic from a personal perspective.
On a personal level, I've been working far more the last year. I haven't seen my family as much, and that's a bad thing. My kids are growing up without me, but having additional family time, because we can't go out and spend time running around with other people, having additional family time is good. In terms of professionally, I think a lot more people are aware of microbiologists and infection control specialists and their role and their value within the health service. So I think that's, again, a good thing. The difficulty is it does mean that there's an awful lot of work to do and there's still going to be more going forward.
So life has changed quite a lot, I think, for everybody, professionally and personally. And this year I am doing a master's degree from home, so it's quite different. Quite isolating at times because it's just really you and your laptop. But I think it's the same for a lot of people doing many different degrees.
What did we learn personally? We learned that doctors can be flexible, they can be innovative, they can be resilient, but it has worn us out and there's a lot of fatigue about.
I think I've really learned that I have a new and renewed love and respect for the vocation that I committed to a number of years ago, but that we are all part of a wider group of individuals and we work best when we work collectively together.
In terms of learning from the pandemic, I think the key thing for me is that we will never ever take things for granted again, not only in a professional capacity, not only in practice, but also in our personal lives as well. And just that ability and that freedom to go about and doing normal things, we will just never ever take for granted again.
I think I learned I'm much more resilient than I thought I was. We've had to do an awful lot of work and work often for prolonged periods of time without a break, making many, many decisions in a day. I've realised the importance of rest, of needing time out and actual proper rest, turning every device off so that I'm not contactable by work, because even when you're off, people will still try and seek your help on the off chance that you'll answer, and you need just complete, total lockout when you're out of work.
I've learned that I am willing to step up to the challenge, and I think that medicine was definitely the right career choice for me. Working on the wards, and being able to do some small thing, to help and to contribute to patient care has definitely been so rewarding.
What we need to do now in the short term, give doctors a rest, give healthcare workers a rest. A lot of fatigue, a lot of burnout, a lot of PTSD. We need a rest. In terms of the long term, the health service needs to be more resilient. It needs more resource and more healthcare workers so that we can expand and look after huge surges in needs, wants and demands like we've seen in the last year.
So advice to myself in March 2020, thinking back over the last year: pace yourself. Heard that a lot this year. Switch the phone off more. Walk more. Most importantly, hug friends and family oh so tightly and as often as is possible.
I think it's been a very tough year. Hopefully I'll not have to do it again. I certainly don't want to work so hard as we've worked in the last year. I don't want my members, my doctors to have to work so hard. So my advice to myself would be try not to work during a pandemic.
So advice I'd give myself before the pandemic started last year is that, you can definitely get through this. I think if people had told me before the pandemic that this was going to happen, I would have said, oh my goodness, I don't know how I'm going to get through this. But, I think we're all a lot stronger than we give ourselves credit for.
If I could go back and give myself one bit of advice, it would be to take your rest. Make sure that you're taking your days off, turning off your phone, not going near your computer, and really enjoying having family life again. Lockdown was challenging, but it did mean that we were spending much more time with our sort of nearest and dearest. And for me, my two kids, watching them grow up, teaching them to ride bikes, having barbecues in the garden, whatever, all of that was very valuable. And it's something that when lockdown ends that I want to make sure that I'm continuing to do.